Mesdames et messieurs, bonsoir et bienvenue à ce webinaire.
Ladies and gentlemen, welcome to this webinar. It is 2:30. We're going to get started. Before I introduce anybody or present you with some logistics, you will see that this webinar is available in English and French. So you have to choose the language of your choice in the interpreting section. Please turn off your video when you don't have the floor. So, ladies and gentlemen, yes, we can hear you just fine. Ladies and gentlemen, welcome to this webinar. It's a real pleasure to count you amongst us today for this third webinar organized by USAID Amplify, which is financed by the US Agency for International Development, implemented by Pathfinder in Burkina Faso, Côte d'Ivoire, Niger, and Togo. As a reminder, this series of webinar focuses on how to manage high impact practices to face a diverse context. The first webinar was focusing on the contribution on health facilities, non-governmental ones, for family planning in Burkina Faso. The second one focused on the mobilization of local resources to support integrated network to support health facilities in Niger. Today's webinar is about the experience of the collaborations with Prefectural Chamber of Trades to have access to sexual health and family planning in Togo. To facilitate this third webinar, let me introduce Dr. Ginette Unkanan. She is a professional of public health and engaged in everything linked to sexual health and reproductive rights, especially focusing on adolescents and health diplomacy. She is current director at Pathfinder and chief operator of USAID Preparation for Resilience in Burkina Faso, which is also financed by USAID. Before we start with the program, she was advisor for the youth for the flagship project focus on youth and scaling up health interventions. Now, it's the pleasure to give the floor to Dr. Ginette, who is going to be facilitating this webinar. You have the floor, Dr. Ginette Unkanan. My mic is on now.
Bonjour et bonsoir.
S'il vous plaît, vous pouvez fermer vos micros.
Can you please turn off the mic for whomever does not have the floor? Ginette, you have the floor. Dear participant, good morning, good afternoon, good evening, everyone, and welcome to this third webinar of this series within the framework of the implementation of the FP Amplify, financed by USAID. We started this series to share with you different approaches, lesson learned, and experiences learned throughout the project, which comes to its end. Today, we're going to talk about a specific topic, which is dear to my heart, but also dear to my job, which is access to adolescents to give them access to sexual and reproductive SRPF. So we're trying to bridge the gap in terms of equity and access to the services and for the youth. And I've always said it, two main things. when we offer services adapted to the youth. The first one is the acknowledgement of their vulnerability, but also the commitment of this youth. It shows that their engagement, their commitment is in a link, which is truly needed in the chain to obtain clear results that respond to their needs. So this commitment, this strong commitment should not only be a slogan. And we all know in the RHFP community that at one point, we all have to get committed to that commitment, maybe on the finance level. But everything that involves Amplify and Pathfinder in Pathfinder International, we gathered our strength to provide resources and make sure that this youth and adolescents are at the heart of the action from the very beginning. And today we're thrilled to say that what started as an implementation of young champions ended with a great partnership of entrepreneurs and that have a direct impact for youth, and especially the youth that's often forgotten. Here, we're talking about the collaboration with the Prefectural Chamber of Trades to make sure that this youth have access to SRPF. And this is all happening in Togo. And if you want to know more, please stay connected until the end of this webinar. Ladies and gentlemen, my name is Ginette Aguncarin, and I'm pleased to share the floor today with a lover of the cause for the youth. He's here. And it's my duty today to dig into information and to learn that my co-facilitator today is a passionate person, passionate for the well-being of youth and adolescents. And I think for that reason, we are the A team because I am passionate as well. So it's my pleasure today to introduce Thibaut Williams, because that's his name. Mr. Thibaut is the director of the regional department of USAID. He is at the head of a dynamic team in countries where USAID is limited, and he provides technical assistance in that area. Mr. Thibaut, it's an honor to co-facilitate this session with me. I would also like to introduce you another person, Dr. Cyril Guéret, who is a physician specialized in health, in public health. He manages the system in Togo very well. He's at the head as he's a country manager for Amplify in Togo. And before he started working for Pathfinder International, he had the same job, the same position in other countries, also financed by USAID. It was the ancestor of AmplifyPF. Welcome. So what are we going to do today? 4 phases. First, a PowerPoint presentation with an overview of our approach for today. Second, a short video where the main stakeholders of this approach will give their opinion. Then we will move on to a panel, which will highlight the several actors and their implementation. And as a conclusion, we will leave some room for question and answers. So without further ado, I would like to give the floor to Cyril Guéret, who will move on to his presentation. Doctor, you have the floor. Good morning, Dr. Ginette. It is my honor in the name of AmplifyPF to present a new great experience for Young Champion, the RHFP Young Champion Initiative, which is called Collaboration Experiences of the Amplify Family Planning Project with Prefectural Chamber of Trades to mobilize youth so that they have access to information and sexual and reproductive health and family planning services. And to move on to this presentation, we are going to follow this following program. After the context, we'll talk about the goals, then the collaboration with the Prefectural Chamber of Trades. Then fourth point, we will talk about the results of collaboration with AmplifyPF and that Prefectural Chamber of Trades. We will go over the impact of activities of the RHFP Young Champions. We'll talk about the lesson learned with this collaboration. We will also share challenges and then a conclusion. So as a context, it's a sub-regional project on family planning, which is implemented in 4 countries in West Africa: Burkina Faso, Côte d'Ivoire, Niger, and Togo, which is financed by USA, implemented by international NGO Pathfinder International for 5 years. In Togo, the project is implemented in 5 health districts, which are very significant ones, with 116 health facilities. 88 of them are public. It covers 2.5 million people, which means which equates to 30% of the population in Togo. It will be focusing on teenagers, 48%, and 42% on youth. Those are the numbers from 2017. The modern contraception prevalence is weak, only 16% for adolescents and 15% for the youth. So the demand is high in terms of the request for, or the need for quality advice for youth and adolescents. And there's a lack of support that provides free choices and clear contraception method recommendation. And there's a strong representation of the youth in the informal sector and those learning center with more young women, especially in sewing, salon and weaving environments. And we want to focus on the great collaboration with the Prefectural Chamber of Trades to mobilize this youth. So what are our goals? So what are the goals of this initiative, the RHFP Young Champion Initiative? It's to reinforce the leadership and visibility of the youth in those ILN, those integrating learning networks. And one of the goals of this webinar is to show the implication of this Chamber of Trades of Commerce and on how they can mobilize the youth to provide them access with quality information, but also show the contribution of these chambers of commerce to reach those specific goals. Now, let's talk about the collaboration with these chambers of commerce. And let's start with the initiatives of the Young Champions. It all started with the identification and the implementation of 30 volunteers in those five integrated networks. They were trained in leadership, rights and sexual and reproductive health, but also techniques to facilitate different social media. What are the arguments? So the youth, which has dropped out of school, is one specific target of this initiative. There's also strong representation of the youth in the informal sector. And also in those learning centers are a great and ideal space for those youth to regroup and get together. So how do they collaborate? They collaborate. It's basically an oral contract those chambers of commerce provide them with areas where they can meet, they participate in these awareness sessions, and they also mobilize the apprentices and their bosses. So the innovating character of this collaboration, but also the participation of unions, mobilization of the owners of those workshops. There's also great participation during those sessions of awareness. And it's a great opportunity to distribute condoms and information.
Voilà, Madame, Monsieur le modérateur, chers participants et chers invités.
And dear guests, what are the results that we have obtained? The implication of these CPMs facilitated access to young champions to 142 learning workshops, and also in places where young people were learning the trades got together. In 2022, we organized 252 awareness sessions in workshops, and we distributed 850 coupons of reference, and we reached more than 10,000 clients, and we organized free device sessions. We noticed some results that I would like to highlight, and we can say that our initiative through this collaboration has had promising results. From 2020 to 2022, in 2 years, we had an increase of 183% of young people who used modern contraceptive methods, and an increase during the same 2 years of 216% of total of young people between 15 and 24 who use a modern contraceptive method. Of course, and see there would be a continuation of the increase, and now 36% additional increase. What are the lessons to take away from this collaboration? Dear moderators and participants, the contribution of actors outside of the health sector is extremely important in order to mobilize youth and teenagers. The collaboration enabled the owners of workshop and little shops to master the themes that are important for young people and teenagers. This collaboration with the trade chambers is a multi-sectorial approach promoting the right to sexual and reproductive health to young people. But in order to increase the participation of the chambers of trade, you have to target what we are doing and make sure that the roles are well understood. But we have challenges in front of us. First, we have to make sure that there is sustainability of the progresses of collaboration. We have to put to scale the strategy at the national level and involve the owners of workshops as well as the young people who are training in this workshop, especially try to reach young people who don't go to school and we are in difficult access in rural areas. Madam, dear guest, dear participant, dear moderator, to conclude, we could say that the AmplifyPF project obtained very good results during the implementation of the Young Champion Initiative for Sexual and Reproductive Health and Family Planning. The collaboration of the prefectural trade chambers with mobilization of young people enabled the project to reach those young people with very clear messages on family planning and reproductive health, and to give them services based on modern contraceptive methods. And we can prove that because we see the increases in the numbers of people who benefit from these services during the last 3 years. And such a collaboration must be continued and must involve other stakeholders who are interested in reaching young people, especially the women in the informal sectors. Dear participants, dear guests, thank you for your attention. Thank you very much, Dr. Cyril. I think we will be able to go deeper into what you have mentioned so far, but I will start the second part of this webinar, which is a presentation of the video, and now I will give the floor from Mr. Lassana Barry. You have the floor. Thank you very much, Dr. Ginette. So in this movie, lasting 5 minutes, it will be supported by a PowerPoint presentation, and it will show how, through the testimonies of specific people, the AmplifyPF project has been implemented with the prefectural trade chambers to generate very good results in Togo. Here is the video. Video, can you launch it? Ali? Yes, I'm here, but I'm not launching the video.
Apologies, just one
Sorry.
second.
Give me 1 second.
Stronger together, oui, plus fort ensemble.
Stronger
Les moyens
together.
matériels et financiers sont certes
Yes.
utiles et nécessaires pour les actions de développement, mais la collaboration est aussi une ressource
financial needs,
indispensable. On est plus
collaboration is
impactant
extremely
en
important.
s'appuyant sur d'autres
It's
structures
indispensable.
comme c'est le cas de la
We can
collaboration du
use
projet
other structures
AmplifyPF avec les chambres
within the framework of the collaboration of the
Togo.
project
Le
with
président d'Agogo
prefectural
Togo apprécie.
trade chambers in
La
Togo.
collaboration
And this
entre
collaboration
et la chambre de
between
métiers
Amplify and the trade
a
chamber
permis
enabled
de mobiliser les
to
apprentis.
mobilize
Et c'est
young
grâce
people,
à
trainees.
cette mobilisation
And this is
que
thanks to this
les jeunes
mobilization
sont venus
that we
sensibiliser
have
nos
been able
apprentis
to raise
sur
awareness
les process non
among
dédiés,
young people
l'espacement
about
des
the
naissances,
processes we wanted
comment
to
s'activer pour apprendre
highlight and tell them how to
Avec ce projet,
learn
ils ont
their
brisé
trade,
le silence
and through this
sur
project we
les
put an
sujets
end
tabous.
to the silence on taboo
Et ils
subjects,
arrivent à prendre la
now
parole en
they
public
can speak out in
sur
public,
leur conception par rapport
and
au
they can
sexe.
talk about what they think
Et ils n'ont
about
pas
this
honte.
issue,
Ça a permis
not
les jeunes
explain what
garçons,
they think
les
as opposed to
filles,
sometimes their
des
parents,
grands métiers d'être
and
ensemble. Ça crée une
that enables
synergie.
people to work
Ça
on
donne
the trade
aussi
together,
la
to be together and
visibilité
to talk about
aux jeunes et à leur
family
métier.
planning issues. And so,
Patrons
this
et
has been
patronnes
very
d'ateliers
positive.
avouent également être impactés par
I
leur
want to tell
collaboration
the
avec le projet
owners that the
AmplifyPF
workshop will
à
be
travers la
helped by the
sensibilisation de
collaboration with
proximité des jeunes champions.
AmplifyPF and in order to raise awareness among young people.
J'appréciais beaucoup les relations
I really
sexuelles sans
appreciate
préservatif, mais nous avons été sensibles
what
sur
we
les
have
bienfaits
been
de son
doing in
utilisation,
order to
notamment pour
promote the use
favoriser
of
l'espacement des
preservatives
naissances. Si je dois
in
continuer
order
avec
to
les accouchements rapprochés,
help
cela risque de
people
compromettre mes
to
activités.
space births more and have
Ce
them
projet a plusieurs
have more
avantages.
time between
On
the
enregistre
births of
les
two
grossesses
children, and
enregistrées
this
dans nos ateliers.
project has several
Cela donne le
benefits,
temps aux
and we
apprentis d'obtenir
can
leur
see
certificat leur
that we
atelier
can
avant
give
d'autres
time to
occupations.
young people to work
Nous
and
avons été
prevent
sensibilisés
unwanted
sur l'usage du
pregnancies, for
préservatif.
instance. So the use of preservative is explained in order to be in control, in order to end up doing something that you don't want to do.
Les bénéficiaires directs ne sont pas en reste. Oui, les apprentis de tous les corps de métier, garçons et filles, sans détourner honte ni aussi tabou du sexe, ils parlent volontiers des changements intervenus dans leur vie sexuelle et reproductive grâce aux causeries éducatives de jeunes sorcières.
Témoignages auparavant, les grossesses étaient très rapprochées. Elles survenaient à peine 6 mois ou 1 an après l'accouchement. À la lumière des sensibilisations,
once a year, and that's too much. So we want more time between pregnancies. So thanks to the AmplifyPF project, I was able to wait longer before having another child. And I had the motivation and courage to keep working and to do what was necessary. And my husband and I decided to receive contraceptive injection to enable me to continue my training, my professional training. And we have raised awareness, and so we wanted to be sure that we reach as many young people as possible.
Par le passé, nous les garçons, nous ne protégions pas. Après les rencontres avec les jeunes champions, j'ai adopté des préservatifs pour ne pas compromettre l'avenir de ma partenaire.
J'aimerais dire merci aux jeunes champions
Now we understand our responsibility, and I want to thank the young champion of Togo to let us know what we could do. It was available to us, and thanks to this training, I committed to do what is necessary to make sure that I didn't have children too close to each other. This video has been possible through the support of USAID. Welcome. Welcome back. So now we'll continue this webinar, and I hope you appreciated the video. I hope you didn't have too many technical issues with this video, but now in this webinar, what we're going to do, and I mentioned it earlier, there were 4 stages, and we're going to reach the third part of this webinar, which will be a meeting of panelists of several actors which were involved in order to generate the result. There will be 4 people in the panel: Mr. Niman Mationa, who is the president of the Prefectural Trade Chamber in Aguenive. I'm sorry if I don't pronounce the name correctly. Madame Kuno Rose, who is a young champion of the integrated learning network of golf, and Mr. Milo Marcel, young champion also of an RIA in Aguetefri. And we also have the 4th panelist who will join us a little later, Mr. Aguravi Ayavi, who is in charge of the AmplifyPF project in Togo. So without further ado, I will ask several questions first. And the first person on my list is Mr. Nima Mathieu. Mr. Mamatura, he's here, and he will say a few words about the role of the Prefectural Trade Chamber in mobilizing the owners of workshops in order to raise awareness about the issue concerning the teenagers. Mr. Mationa, you have the floor. Thank you. Mr. Niman Massola is at your service, and we represent the Chamber of Trades. The CPM regroups a number of organizations and companies in order. We have 173 trades which are covered here. in fields like sewing, hairdressing, carpentry, mechanics, weaving. And to go back to the question, we can mention a number of instances where we have done what was necessary to facilitate the access of young people, to teach also this issue of health and family planning to the owners of the workshops, to mobilize the owners in order to launch initiatives that will be beneficial to the young people. And young champions were able to come and talk to them to show their people working for them. And I have to tell you that every Monday, the trainees met in large number in social centers, and we were able to call the young champions to speak to them, and we put at their disposal without charge meeting rooms and documents in order to help the meetings. Thank you.
Thank you so much. Now, we are going to continue. You've mentioned about the close collaboration with the young champions. Can you please go deeper into the subject? How do you appreciate this collaboration with the youth? Because they are young, they are aware of their potential, they are committed, and they want to work with their peers. So how do you, as the president of the Chamber of Commerce, how do you appreciate this relationship? Thank you. This collaboration with the Amplify project was of an incredible wealth to us. It enabled our apprentice to have access to information, important information. It enabled to adopt responsible behaviors. Thank you so much. Thank you so much. Now, I'm going to move on to Mrs. Rose Kunguino. She's a young champion. And I want to hear your version, because Mr. Nima said it earlier. You had to work with him in this approach. Could you please give us your version of this collaboration? I heard the other version. I want to now hear your version as a young champion about the partnership with a non-traditional approach. How do you appreciate it? How was your experience of this collaboration? You have the floor, Mrs. Rose. Thank you, Dr. Ginette. Our collaboration with the Prefectural Chamber of Trades was an incredibly beneficial experience. It enabled us to reach more youth and adolescents by integrating essential information on sexual and reproductive health within the common programs of our meetings. With this collaboration with the Chamber of Commerce, we were able to facilitate chats, fireside chats related to health, reproductive health, and FP. We talked about unwanted pregnancies, causes and consequences, contraception methods, and those different themes, those different topics are chosen during preliminary meetings amongst the different champions who represent the Chamber of Commerce and the delegates, the representative of the apprentices. And through this incredible relationship and collaboration, we created this enabling environment to promote healthy sexual health and reproductive health information. Thank you so much. Thank you so much, Mrs. Rose. I would like to now move on to a different part of the subject. So you really enjoy that collaboration with the president of the Chamber of Trades. But now we're also talking about the business owners, as we saw in the short video. Can you please give us your comments, your reflections about your work with the business owners, which was not the primary target of the intervention, but this is something that you managed to achieve and include into and embed into the project. So can you please give us your reflections about it? Thank you, Doctor. Now, regarding our collaboration with business owners, that collaboration, it was not easy at first. And they were a little bit more wary and did not provide us enough time for awareness. But with time, their participation was really key. And it really provided positive changes in the life of those adolescents and youth. Up to this day, we can even say that some business owners have become basically a spokesperson during those meetings and help us get involved directly with their apprentices. So we're incredibly grateful to them for their commitment, their availability, and their collaboration, and also their support. Thank you so much. Thank you so much, Mrs. Rose. I will come back to you for the questions. But as we said it earlier, I think it was hard at first, but in the end, you managed to rally these people, these business owners, and rally them to your cause. Third question will go to Mr. Migilou, if you're here. Now I'm interested to get your point of view. You are also a young champion. We've heard Mrs. Rose's testimony. And I would like now for you to help us understand your process on a practical level. How do you do when you are on the field, on the floor, to facilitate and to work with those youth in those workshops? Thank you for this question. And let me shed some light on the type of awareness that we do in the field. So first off, it's awareness with small groups. So basically, there are specific days where we focus on that. We're focusing on education, also work with a larger group such as apprentices. And we work in those locations provided by the Chambers of Commerce. So to answer your question, we work with 4 steps. First of all, the Chamber of Commerces bring us autonomy. Second, we organize prep sessions with them. Usually the president is around with their staff, represent the different trades, but also we also work with all the representatives of different trades. So we have a location, a topic, and support. Usually the apprentices give us the topic that they want to work on. And the president and their staff are in charge of organizing the event. They invite us to visit the location, to provide information and feedback on the location. Then we provide. We want to make sure that those workshops will work. So we have this prep session, and we get the help from resource people, which are the young ambassadors, providers, social focal points, which also support us during the preparation of these meetings. Thank you so much. Thank you so much, Mr. Migilou. you said something that resonated with me. The apprentices give us the orientations on the topics that we want to talk about. This is very important to hear. It means that you don't have all the knowledge from the get-go. You don't really know what they need. You go directly to the source of information, and that's what's key here. This is what we need to do in all our programs. Go directly to the user, understand what the need is, and create a program that meets their needs. Thank you for that. According to you, you've done this incredible job. But you know that there's always a beginning and an end to a project. That's a definition of a project, a beginning and an end. How are you going to do so that the youth, the adolescents, continue at the end of this project to keep using what they've learned? As you just said, there's a beginning and there's an end to each project. So to make sure that they keep using the AmplifyFP services, first of all, we need to keep multiplying the actions on the field. Orientation, support. We often support the youth towards so that they go to health facilities. So we want to help them continue to do so. When they get there, we know that the services are not for free, and financial needs are issues. And sometimes they can't have access to the services because they don't have any money. So we're working to make those services, make them available for free in the country. Thank you so much, Mr. Miguelou. I think there's some voices that will be louder than me for this advocacy, but the free access to services needs to be a national priority. It needs to come from a very higher level so that we can do the advocacy work and we continue that fight. But of course, there must be a political willingness for that, to meet those goals, and to do so, a specific number of effort must be provided at the highest level. I said it at the very beginning. I am not alone in facilitating this webinar. There's another one. He is young, so but you it's in the heart. But he's young and he fights for the youth, and I must give him the floor and let him continue the co-facilitation of this webinar. Mr. Thibault, I invite you to continue facilitate this webinar. Thank you. Thank you for giving me the floor, Dr. Ginette. It's very true. I'm a young champion. Unfortunately, I'm not that young anymore, but thank you, though. It's a pleasure to be amongst you today. For me, holistic approaches and access to information and services for youth are key issues for the health, social, and economic development for West Africa. So thank you. Thank you, AmplifyPF Project, to grant me this opportunity to co-facilitate this session with Dr. Ginette. My name is Thibault Williams. I'm Director of the Regional Bureau for Health of USAID in West Africa. It's our pleasure to collaborate with AmplifyPF of Pathfinder. I really trust it's a key project because they work in health facilities to provide better information related to family planning and reproductive health. But they work also outside of those health facilities. and they are dealing with the key elements that influence the use of those services. A great pleasure to talk about this experience with the Prefectural Chamber of Trades. So what we're going to do now, I'm going to ask 4 questions to the panelists, and then we're going to move on to a more open discussion. The first question is for Niman Mathurin, the president of the Prefecture Chamber of Trades of Kagwe. Mr. Mathurin, how do the prefectural chambers of trades can continue to support the youth after the end of the project AmplifyPF? Thank you very much. The good thing never lasts. We have learned that the project will end this year. We are currently talking with the young champions to see how they will be able to continue these awareness sessions in those areas. Thank you.
Merci, Monsieur Nima. Est-ce que les jeunes ont déjà mentionné des idées pour pérenniser un peu les activités?
Mr. Nima, do young people have ideas about how to ensure sustainability while working with the prefectural trade chambers, or what can you do to help that? We want to continue to facilitate access to the training workshop in order to raise awareness and to place for free at their disposal rooms where they could have meetings with apprentices in order to talk about this issue, and we give them a document that may help them. And we try to help young champions to work together and receive the support of other partners and use the goodwill that exists in our area in order to organize their intervention with the apprentices. Thank you. Thank you for this very interesting answer, Mr. Mathurin, and also thank you for your ideas. It is very important to get kind of support. It's concrete support, but it's very important, but it shows how important it is to receive information for young people when it comes from organizations like the prefectural trade chambers. The next question is for Mr. Agnebabi Ayayi, who is in charge of monitoring and of USAID, and what are the aspects that are the most important for you in the collaboration with prefectural trade chamber? The first thing we want to talk about is the strong mobilization of young people who are not in school through this collaboration. And we have to say again that the prefectural trade chamber made it easier for apprentices to meet and to receive information about access to services. The trade chambers also help mobilize owners of workshops who often were reluctant to hear young people talk about sex because it's still a taboo subject in their workshops. But these owners ended up understanding really the importance of the issue, and now they collaborate with us to meet this unsatisfied need. The second thing we have to highlight is the availability of the young champions themselves who were trained by the project in order to raise awareness with their peers. And we also appreciate the contribution of this collaboration, which enabled more young people to have access to the supply of family planning services in health facilities, as we showed in the numbers we showed in the PowerPoints at the beginning of this webinar. Thank you. Thank you, Mr. Agnebabi. I think that these aspects are very important to stress the collaboration
with the prefectural trade chambers, but also the differences we have done to mobilize young people. But are there things that you think could be improved further in the future? Things we can improve is that the number of young champions we have now, compared to the goal, it is not sufficient. We also think that we have to make this collaboration more formal through writings, but this means we have to ensure the sustainability of the action of young champions in their communities after the end of this project. Another thing we could improve is to create documents about this collaboration, and it has to be shared with the Ministry of Health and other partners who intervene in the field of young people's health and also teenagers' health. So I think these things could be improved. Thank you. Thank you, Mr. Agabavi. It is duly noted for USAID and for the sustainability of family planning. Next question is for Mrs. Cunino Rose. Madam Rose, how do you manage the distribution of contraceptive in meetings, in workshops? Thank you, Mr. Thibault. Regarding the managing the demand for contraceptives, we have meetings with discussion, and we distribute folders and sheets of papers that indicate what the answers that they could have about contraceptive, and this enable them to understand all the methods of contraception that are available. Thank you. Thank you, Mrs. Rose. And if a young person, after reading the document, wants to have access to a method, what do you do? If, for instance, a young person wants to adopt a contraceptive method, we usually refer that young person to the provider of health services with reference coupons. We also write down the names of the people who want to request contraceptives, and there are special days of about family planning organized by Amplify. We call them in order to guide them toward those health facilities where there are special days organized in this respect. And we must also say that there are special days organized about family planning, organized by the project Reaching Young People. And to conclude, as a strategy to better manage this demand, we focus our actions in the towns and villages where the special days will take place, and we are very active in 2 or 3 days before this event. Thank you. Thank you, Madame Rose. And based on your experience, what are the contraceptive methods that are the most demanded, requested by young people? Thank you. The contraceptive method that is the most popular among young people immediately or directly when we are in the field, in the learning workshops, and when we have proximity and discussions, young people mostly ask preservatives, Febidom, and condoms. And in this way, we use this opportunity to demonstrate how to use a preservative. And since it is the preservative that they can obtain right away in the field, we give them these preservatives that we should give them the preservatives provided by the Amplify project. And regarding the other contraception methods, we refer them, as I said, to other health facilities. Thank you, Mrs. Rose, to share your
rich experience about this subject. It is very important to listen to the opinions of young people, as we said. My last question is for Mr. Marcel Miguelou. Mr. Marcel, as young champion, what is your opinion about the collaboration with the prefectural trade chambers? What are the things that go well and the things that could be improved? Thank you for your question. And I would say that the collaboration with prefectural trade chambers was very beneficial for us to implement our activities and reach young people, especially those who do not go to school. And this collaboration facilitated things for us, as the other panelists mentioned. And I want to just repeat a few things that were said before, is the fact that the owners of workshops now are more ready to collaborate with us. There is more mobilization of the trainees and apprentices. And we talked about it in order to reach the goal. And they place at our disposal rooms and locations where young people can meet and help raising awareness through various activities. And beyond the information that we bring on the sexual health and reproductive health, this collaboration with the prefectural trade chamber enabled the young champion to have better visibility on what can be done and what they can do to help their peer who do not go to school. Thank you. Thank you very much for the answer, Mr. Marcel. It is very encouraging to see young people doing these kind of things. And I want a follow-up question. According to you, what can we do to encourage more young people like you to get involved in this initiative in order to improve access to information in the services of sexual and reproductive health? Yes, what should the project do in addition to what it does now to help motivate young people? I think we are involved in order to make better known the work of the young champions in Togo, and this is something we have to do in order to make them better known and try to raise other young people. At the beginning, it was difficult, but then with the help of the trade chambers, it has become easier. And now, because we have spent time with owners and of workshop and apprentices, we have been able to mobilize more people, and we're on the right track. And we're still very active in the field because owners of workshops and apprentices need us now. They understand how important it is for them. And they call us sometimes to come talk to their employees, to their apprentices. And if we have, even though we don't have much time, we take the necessary steps to go talk to them. And so I think this project, of course, will end at some point, but even after that, we will continue our activities because we are on the right track and we want to keep helping young people. Thank you. Thank you very much, Mr. Marcel. It is very encouraging, and I want to congratulate you for this energy and this enthusiasm in order to keep working in this field. So thank you, everybody. I do not have any more questions for the four panelists. I want to thank them for the very complete answers. Now we will have a discussion with more open exchanges with members. Participants will be able to ask questions through the chat box or directly. Dr. Ginette, do you want to ask the first question from a participant? Yes. Yes, Mr. Thibault, thank you for the panel members. And I stress again what you said. We have to
improve the involvement of young people and the dynamism. It is very, it warms your heart to see that we are making progress. So, Mr. Thibault, I don't know what's happening, but we do not see you. We want to see if you are young or not because your camera is off. We cannot see you, but anyway. So I would like to ask questions for this FAQ stage. We had many questions concerning the young champion, and someone was asking who are the young champions, what are they doing, and how are they chosen. And I will ask this question to Mr. AmplifyPF to tell us in a few words what it is about. You have the floor, Mr. Abou-Gabi.
Are you here? Yes, I'm here. Thank you so much. The young champions in RHFP are youth that was identified in the 5 districts of intervention of the project, and who are part of the 18-30 years old, and they were trained on leadership. And they try to go in various workshops and even beyond workshops to implement the activity that we called the initiative, the Young Champion Initiative. And those activities are activities that are called interaction sessions with peers. So we have the youth that have dropped out of school, but also youth that are involved, who are in school, and everything that they can implement to bring awareness and also bring other activities, which are conferences, but also communication, digital communication campaigns through different social networks that we use so that they can convey information, organize webinars, and provide information on reproductive health, rights to sexuality, and family planning. So this is more or less who those champions are. There's 30 of them scattered in the 5 districts, and they are being coached by the youth agenda, which pre-existed. And I got involved at some point. I jumped in and they showed really good results. Thank you so much. Thank you. Please stay, because there's another question which is about the young champions, and ask what is the collaboration of these young champions with the existing partnership of WAGA, because there was a Ouagadougou partnership. Was there some sort of partnership with this platform, or are some of these youth, though they find themselves on the other side of the equation? The collaboration is more with young ambassadors in Togo. That collaboration doesn't really come to life because their actions were not as visible. But there are some exchanges between this youth, definitely. Thank you so much. Now, I'm going to ask another question from Madame Nina. Excellent question with regards to coupons. What are these coupons? And what kind of mechanism was implemented as follow-up? Madame Nina, are you here? Madame Nina? Sorry, it's not Madame Nina. Madame Rose. Sorry about that. Yes, doctor, I'm here. So this is, in your life, this is what happens. So can you please ask the question again? So what are these reference coupons? What are they used for? And what is the mechanism that was implemented as a follow-up and monitoring? Thank you for this question. Those reference coupons are basically vouchers. Vouchers that could be used by the youth and the adolescents who want contraception methods to have access to them. There are different types of vouchers available. We have IST reference coupons, HIV coupons, advice vouchers, and contraception method vouchers. So during those awareness sessions, before the youth is being provided with a voucher to go to a specific health facility, especially during, those open days, free days, we exchange with them, and it's based on their needs. It's based on their needs that we give them the voucher. So for example, if it's just to get advice, this young or this adolescents will be given a voucher that is dedicated to the advice voucher. When he or she arrives at the health facility, they will present that very voucher and get what they need. Thank you very much. Thank you so much. I'm going to let Mr. Thibault continue with a few questions. Monsieur Thibault, please. Thank you, Jeanette. So you can see my camera. Much better. I'm not young. We're having issues with connectivity here. So how about to make them durable? What will be the main ideas to continue this project? We talked about it. We talked about what the chambers of trades can do. What would be the challenges to make them durable? Now we can ask the question to Mr. Nima, and maybe if one of the champions want to intervene, we'll give them the floor. Nima, you have the floor. Mr. Nima, you have the floor. Maybe if he can answer. Madame Rose, maybe you can take the floor. How would you make those activities more durable? Mr. Marcel, maybe you can take the floor. Thank you for this question. And maybe I can bring a little further information to what was said on the mechanisms of follow-up and monitoring. As she said, there are 3 different types of vouchers that are available. The advice voucher is the one that's more used because this is a good way to get further information. The FP one enables them, once they're in the health facility, to be provided with FP services, which were not always free, and the HIV, and this is where the HIV one, this is the one that we want to focus on because it's definitely not free. Now, as far as follow-up and monitoring is concerned, we get in touch with those apprentices and we create focus groups. Once they have the voucher, they immediately integrated and accepted on the platform. And then we can follow and monitor easily what we do with them. And we work with business owners to see if those apprentices, to see who has visited what service and why. The focal points also help us to monitor, to gather the vouchers. And then after that, we can evaluate how many vouchers we used. Now, with regards to the question about the questions regarding the challenges to make it durable. We must, the idea is really to accompany and support this youth. And the main challenge is to work with business owners. We want to continue to involve them so that they can continue that work, just in case we're no longer, in the workshop or not. So make them aware and keep them trained and involved. We want to continue that work in the workshops and also in the field. Thank you so much. Thank you, Mr. Marcel. I see that Dr. Cyril has raised his hand. Would you like to bring a new contribution? Yes, a contribution, definitely, to bring further information. First of all, the young champions were identified and selected through young ambassadors with the collaboration of the Ministry of Health, through the adolescent youth and division in Togo. We already worked with a panel of youth association. So we basically created meetings where those youth associations were represented. The initiative was presented and volunteers selected during these assemblies, and those representatives became those young champions. How about the challenges? Yes, the challenges are definitely real. And usually it's the end of the project is the end of the initiative. And the end of the initiative means that everything that supports this initiatives, namely the donations, internet connection, the payment of transportation to facilitate activities. And it's at that point that the youth are really needed. And this is where the business owners need them to accompany the support of those projects. So when the project ends, they get more involved. The collaboration with partnerships in Ouagadougou, if we are currently organizing because they already belong to different associations. It would be too much to create another association. So it's basically, they are going to get reorganized, and they are already very comfortable in this environment. And they will work on the think tank partnership of Ouagadougou. That was my contribution. The definition of youth is not a standard one. Sometimes we need to go all the way to 30 years old, sometimes 35. It depends what we want, what we're looking for. It depends on the informal area that we want to intervene. Sometimes we go beyond the 24 years old mark. And so we have to adapt. Thank you so much.
Beaucoup de curiosité sur l'approche des jeunes champions.
See that there is a lot of interest about the young champion, but I will ask a last question before leaving the floor to Dr. Ginette and the last question and summary to conclude. I saw a very important question about the health providers, and sound is very bad. I wanted to know how the project was able to fight against the bias of health providers and the stigmatization of young people who are sent to health facilities. So how can we fight this bias? I don't know if it's for the question for Dr. Cyril, if someone else among the panel members who would like to answer this question and add some contribution. Yes, Mr. Thibault, if I may, the question is about the bias of healthcare providers. Yes, that's it. In Togo, the bias against young people who are asking for services in family planning. Yes, in Togo, these services are not free. So when young people are referred to health facility with a reference coupon, when they arrive in the health facilities, in spite of the fantastic work that has been done in the field of family planning, young people often are not able to get products because of the cost. So we organize special family planning days during which we provide free products. So we target the health facilities in order to organize these days where we provide free service. So we make sure that we mobilize young people to go to those health facilities where there are days or special days organized to provide free product and services in family planning. Thank you. And beyond the financial aspect, sometimes there is a stigma from the healthcare providers against young people. What could we do to reduce this bias and this stigma? Am I supposed to answer? Is it Mr. Thibault? No? Thibault? Yes. There is something very important, which is the training of healthcare providers. In our integrated health network, we have trained members of the healthcare professions, and we tell them what we do, and we tell them how to help young people, and make sure that they shouldn't consider young people are their young brother or young sister, and they don't have to teach them anything. they have to accept their free choice of family planning services. If they want to get them, that's what we tell healthcare providers. That's what we want to tell them. Thank you. Thank you, Dr. Cyril. Thank you for this information about financial aspect and also stigma and bias that has to be overcome. And again, there's connection problems. Dr. Ginette, I'll leave you the floor if you have more questions to ask. Thank you very much, Mr. Thibault, and thank you to all the people who asked questions and to the answers that were given. I would like to give the floor, since you have 5 more minutes. I have 2 raised hands, and I will enable them to ask their questions very quickly and try to answer them. I don't know if Mrs. Umatoure, who raised his or her hand, can you ask your question in a few words, please? Can you hear me? Yes, go ahead quickly. Yes, I will be brief. I work for USAID Côte d'Ivoire, and I would like to know about the young ambassadors. How did you document, or can you document the success stories? Because it's very important to document what has been accomplished in order to have a database that shows successes. And I think that our friend from Togo said he didn't have this kind of database. So I think it's important to encourage this in order to get success stories on paper, if I dare say. That would be very good to promote our goals. Thank you, Mr. Touré. And now I will give the floor to Ousmane very quickly, and that I will ask the panelists to answer the question. Thank you, Jeanette. I don't know if you hear me. Yes, very well. I wanted to talk about 2 things quickly. No sound. On the question of sustainability, many people mentioned some ideas, but we have to work on this. Try to strengthen the capabilities, the capacities, and in order to allow the health professionals to better interaction with young people, and because often they are not motivated enough. And the other thing is we have also, maybe I want to say, to consider the workshops as schools, quote-unquote schools, in fact, because we have to teach the young people a number of things and make sure they know how to get in touch with healthcare providers. But and when you have new girls, for instance, start work, they have to be able to ask questions, and we have to be able to answer this question. The other thing that's important is a question of availability of services. As you said, there are some aspect that has to be integrated, and there have to be some advocacy. And we have to create demand, to promote demand, but through actions, concrete actions, in order to make sure that the services are free and that there is no bias against young people when they come and they can receive the services. This is what I want to say in a few words. Thank you very much. I think your comments were very positive, and the product team will try to use them to improve things, to work on sustainability and how you can use and build on the success stories. And I would like Mr. Avi, he knows I would ask him a question because it's his field. Mr. Adoubavi, can you tell us in a few words about the questions about documentation? I'm surprised that nobody had mentioned this earlier, but it's very important, and I'll give you a few minutes to talk about it. Thank you, Dr. Ginette. I can reassure you. And there is a success story. It is being written down, and we are going to send it to all the young champions and beneficiaries, and we are compiling qualitative information that you receive. And as soon as possible, we will disseminate these success stories to motivate further young champions. So this aspect is taken into account.
already now. Thank you. Thank you very much. So we are close to the end of the webinar, and I will ask Mr. Thibault to have 30 seconds for last word before I conclude. And Mr. Thibault, do you want to say a few words? We have not been able to answer all the questions, but we can maybe use emails to send information after the end of the webinar. Thank you very much, Dr. Ginette. So I'm seizing this opportunity to thank all four panelists, other participants in this very interesting discussion. I think that we have talked about very important issues concerning mobilization of youth and improving access to service to promote sustainability, and how to talk about various aspects which are not strictly speaking health issues, but also some things with social and cultural components. And so it's a very enriching conversation, and I'm very happy that we have had this opportunity to participate in this webinar. Thank you very much. Thank you, Mr. Thibault. It was a pleasure to have you with us today. I know that you were traveling. It was a long trip, but thank you for being here. It shows your interest in a subject, and I'm not surprised based on what I know about you. So, dear participants, I think we're now close to the end of this webinar. And as I mentioned earlier, the reduction of inequalities or inequities of access from teenagers to services forces us to make well thought out choices. I hear often people who say you have to think outside the box, but I don't think we have to think outside the box. I think we have to have a mindset that enables us to to make a box bigger, because they are very effective traditional partnerships, but we have to explore other possible collaborations, and we have to dare. And I wanted to conclude this webinar with two things. If for any reason you were not able to follow the whole webinar, I want you to have two main takeaways. First, the unexpected result of this approach, it is very positive. The primary target of this intervention were apprentices in hairdressing workshops and similar workplaces, and there was a snowball effect through agreements with the owners of the stores and workshop, who also are fathers and mothers of young people and teenagers, and maybe they had some challenges to overcome with their own children. And with this intervention, they feel much more at home now and are better equipped to talk about these issues with their own children and also then with their apprentices. And it was very important. Someone said we have to work on this workshop and store owners. And the second thing is very important, it to have the target. The target is very diversified. Not every teenager thinks the same way. So it is very important to understand them. It is not just the medical needs of these people, their cultural and social aspect. And so it is not possible to claim to answer their needs if we do only one thing in one manner only. And so we have to have free talks about sexual and reproductive health and family planning. It has to go beyond the purely health issue, but include a social and cultural aspect. And you have to have a collaboration with various stakeholders. And what we have seen during this webinar is a perfect example of this approach. Ladies and gentlemen, I would just ask you one question to conclude. Who is the main major partner who will bring to the table in order to intervene in favor of young people?
This being said, thank you to everybody to have been present today, and thank you for the other moderators and to the panelists and people who intervened during this webinar. Thank you very much, and talk to you soon. Thank you, Jeanette. So there will be a third webinar. Thank you to everybody. The next webinar will take place on June 22nd about the special days about family planning in order to reduce financial barriers to use of family planning products and services in Côte d'Ivoire, and we'll be happy to see you again. Thank you. See you soon.
Merci.